Are you retired and turning 65 soon? This video from the Wisconsin Department of Employee Trust Funds, or ETF, will help prepare you for the transition to Medicare. Most of the information provided in this video applies to retirees. Meet George. He's been retired from state service for 2 years and has continued his health coverage through ETF. With his 65th birthday coming up, he is curious about what Medicare means for his health benefits. First, let's look at the different parts of Medicare. Medicare Part A is your hospital care. It helps to pay for inpatient hospital stays and a couple other things such as hospice care and skilled nursing facilities. Typically, once you turn 65, you are automatically enrolled in Part A. You likely don't have to pay for it in retirement because you already paid for it through payroll taxes when you worked. Medicare Part B is your doctor care. It helps to pay for routine health care, including medical visits and lab tests and more. You have to pay for Part B once you enroll. We'll cover that in a moment. Now on to Medicare Part C, which is optional. You have Part C only if you're enrolled in a Medicare Advantage plan. These plans are a combination of Parts A and B and oftentimes have supplemental benefits. If you select a Medicare Advantage plan, you still have to pay for Part B separately. ETF offers a Medicare Advantage plan. Visit the Benefits Available to Me page and enter your former employer's name to see health plan information. Medicare Part D is your pharmacy benefit. It helps pay for prescription drugs you may need. Your health plan with ETF includes Part D, so you don't need to take any extra steps to enroll. Next, let's talk about how George can get ready for Medicare. A few months before George turns 65, he'll receive a letter from ETF asking for his Medicare information. He'll need to complete the action steps outlined in the letter for a seamless transition, including enrolling in Medicare Part B. Around the same time, he'll also receive information from Medicare and Social Security. If George hasn't received this information within a month of his 65th birthday, he should contact ETF or Medicare. His spouse will go through the same process prior to her 65th birthday. We recommend applying for Medicare up to 3 months in advance of your 65th birthday. Coverage with your new plan will be effective on the same date as Medicare, usually the first of the month in which you are enrolled in Medicare. When George becomes eligible for Medicare, he can choose a new plan design or health plan, like he could during open enrollment. He might consider switching to Medicare Plus or Medicare Advantage to lower his monthly premiums and get nationwide coverage. George and his wife currently have a local county-based health plan. If he doesn't make any changes, he'll move to the Medicare version of his current health plan. Any plan that George picks will coordinate with Medicare, meaning Medicare pays first and then the health plan pays second. When George begins Medicare coverage, he will see some changes. He'll start receiving statements from Medicare. He will pay less money, if any, when he sees the doctor or uses other medical services. His monthly premium, or the amount he pays each month for ETF's health insurance, will decrease. However, he will have to pay for Medicare Part B separately. If George is receiving Social Security, his Medicare Part B premium will be deducted from those payments each month once he enrolls. If he delays receiving Social Security, he'll need to pay Medicare directly each month for Part B. George can see how much his monthly premium will change by visiting the Benefits Available to Me page and entering his former employer's name to see his health plan information. If George is covered by ETF's life insurance plan, he will no longer have to pay these monthly premiums. Lastly, parts of his prescription drug coverage will change. George should look at the prescription drug formulary to see how his drugs will be covered under Medicare Part D. The formulary is a list of all covered prescription drugs and at what level your copayment will be. Since George is a state retiree, his spouse will still have the same benefits package until she becomes eligible for Medicare. This would also be true if George had other dependents covered by his plan, such as an adult child. As you can see, George has a few steps he needs to take to ensure a smooth transition to Medicare. If he has any questions, he can contact ETF or Medicare for more information.